Hello, everyone. You're welcome to tonight's session of Let's Talk About. We are diving into a very interesting topic, which is dental health. According to World Health Organization, 3 out of 4 persons have dental challenges, which means right from childhood through to adulthood, people have challenges with their teeth in the world. We have taken this at heart and decided to discuss it so we learn the importance of dental hygiene. I'll be your host, and my name is Yeboah Akosia Echa, and I'll be doing this with my wonderful guests, Dr. Clarence Osai and Dr. Osei Tutu, and they are dentists. Let me remind you viewers that we are live on our social media platforms, both on YouTube and Facebook, at the Trinity United Church, East Legon. You can send in your questions and comments on our social media platforms or to our WhatsApp number 0501 579 996. Good evening, gentlemen.
Good evening.
You're welcome to tonight's session of Let's Talk About. Today, you're going to help us understand more about dental hygiene, and I know that you're well able to do that. So let's get right into it. So my first question here is to you, Dr. Clarence. Could you help us define dental hygiene and give us some importance to it?
All right. So, thank you, Sean.
You're welcome.
All right. So basically, dental hygiene is everything that goes into protecting and making sure that the oral cavity is clean and satisfactory. It goes beyond just most people think when they think oral hygiene, all they think about is toothbrushing.
Yes.
Or, brushing twice a day, the basics that were taught when we were children.
Yeah.
But it's more than that. So oral hygiene, basically the oral cavity is the gateway into the entire body. So imagine like you have a house and you have a gate, but you don't protect your gate.
Mm.
It's leads you to all forms of attacks.
Yes.
So think about the mouth the same way. That's what I want our viewers to think about. So if
Okay.
you don't take care of the oral cavity, which is the gateway to your entire body, you are leaving yourself prone to many diseases and attacks. So that's why oral hygiene is extremely important and it shouldn't be neglected.
Okay.
So it's basically that's
All right. That leads me to my next question, Dr. Osei Tutu. Could you help us to know what the common dental diseases are caused by? Sorry, let me put the question again. What are the most common dental diseases caused by poor oral hygiene? What are the things that our bad behaviors would allow us to have poor dental hygiene?
Okay, so like he mentioned before,
Yes.
there are certain things that are required of us, okay, to be able to keep our teeth, our mouth clean.
Yes.
Okay, but also there are things that we have to avoid.
Okay, like?
Okay, so at home, when you talk about hygiene, there are things you do.
Yes.
Okay, there are things you avoid doing. Okay, so if you talk about hygiene of your hair, for example, you know that, well, if it is easier for you to take care of your hair when you keep it short, then that is what you do. Okay, so you don't keep it long so that it's difficult for you. Okay, so in the mouth, we have the same issue. So apart from certain things that we need to do, like the brushing and things like that, there are things we have to avoid. Okay, so together, they form what then becomes good oral hygiene, good oral hygiene practices. So there are many diseases and effects, things that can happen to our teeth and mouth. But like you pointed out, we want to narrow down on things that are a consequence of poor oral hygiene. Okay, so the commonest ones would be tooth decay. Okay, so I think in our environment we call it caca. Yeah, so tooth decay. So it's basically holes in teeth. Okay, so cavitation of teeth. But I always say that is actually quite strange to our environment, really the most common, traditionally what has been the commonest disease as a result of poor hygiene is gum disease, and then disease that affects the supporting structures of the teeth. So we'll call it periodontitis. That's a long word, but it is just disease that is affecting the surrounding structures of the teeth, especially those that help with its support. You know, the teeth are in bone.
They are in
bone. Okay, so that's how come they are firm and you're able to chew on them. Okay, so anything that affects that support, okay, and weakens it particularly, we refer to it as periodontitis. And then the gum that clothes the necks of the teeth and the bone in which the teeth sits, okay, when they become sore, inflamed means they are bleeding easily, they are reddened, things like that. Okay. We will say gingivitis, so it's inflamed. So those are the commonest things that affect our mouth, our teeth. That's a consequence of our oral hygiene practices. Yeah.
Okay.
I'd just like to chime in a bit about that. I think so. I'm in full agreement, obviously.
Okay.
So these things usually with the extremes of age. Most times, most people deal with when we talk about cavities and tooth decay.
Yes.
They are swaying towards the younger population.
Okay.
But when most elderly people would typically present with the gum disease.
Okay. Why?
Gum disease usually is associated with certain comorbidities, other diseases which as you go you get. That's including diabetes, hypertension. Okay, so these things, aside that, certain medications that we take, they all play a role in affecting the supporting structures of the teeth.
Really?
Yes. So.
Oh, okay.
So if you find somebody who is say on taking antihypertensive medications, they typically present with sometimes gingival swelling and bleeding. So it's very common with for gum disease. It's very common for people who are a bit older, but for the younger people, you usually find if you see them, they are the ones who usually present with tooth decay and other things because of, again, diet, what they eat, and their habits. Mommy, I don't want to brush my teeth this evening, and other things like that. So that's why it becomes. But that notwithstanding, it doesn't mean that you wouldn't find cavities in an elderly person, or you wouldn't find gum disease in a younger person. It's just what's more common to say.
Okay, could you please explain what cavity means?
Cavity.
Yeah.
So when you think of it, a cavity is just a layman term for, say, a caries, which is tooth decay.
Okay.
So a cavity, when you think of a cavity, literally, it means like a hole. Okay. So we just say there's a hole inside it, we just call it a cavity. So when decay goes on for a while,
right,
unnoticed and unreported, unattended to, thank you, it continues to progress. Naturally, the bacteria which are inside, which are causing it to propagate, having been attended to, is going to continue to propagate until it reaches a point where it would affect the living tissue of the tooth.
Okay.
The tooth is in different parts. So the white part that we see isn't the totality of the tooth.
All right.
Okay. So the tooth is in different layers. There's the white part that we all see.
Yes.
But inside, there's also a part which has blood vessels and nerves.
Okay.
So once the cavity is progressing slowly, and it's not attended to,
yes,
eventually it can reach either very close to, or it can actually reach the nerves and the blood vessels.
All right.
Once it touches that area, that's when you start feeling pain, and to manifest in different ways. Initially, you may start feeling it on and off, here and there.
Okay.
Maybe only when food has entered the cavity, that's when you feel it. But one day, to reach somewhere, there's no food in your mouth, but you are feeling the pain.
Can it go to that extent?
So it can go beyond that extent even. So it's something that's very important that we like to coach on.
All right. Thank you so much. So for me, I have an experience with, my tooth. So many years ago, I don't know how it started, but all of a sudden I realized that I can't talk well because when I'm talking, I don't know whether it's saliva or it's the mouth that produces liquid. So it will just be my mouth, and I can't talk well. I can't sing, and I just didn't know the problem. But I think last year I went to a doctor, and I don't know what she did to it, but it became better. But when I came back to Ghana, it was still persisting. We even had a scan, right? They said one up here and the other one down here is turned upside down. What could have caused that?
Okay.
Please, if you
So
take that.
you talked about the saliva in the mouth. Okay. So it's a common symptom. So when you have discomfort in your mouth, whether it's a foreign body, when you have pain, a sore area in your mouth, you tend to salivate. Okay. So that is what we are feeling. Okay. So around our age, a very common complaint is about wisdom teeth. Okay.
Please, if you say our age, which of the age?
Also from like early 20s to maybe the 30s. Okay. So you have a lot of complaints, and that is usually around the wisdom teeth. And the clients would mention to you that it's a tooth far back, okay, far back behind the rest of the teeth. Okay, the gum there is sore. They can't close well. When they are swallowing, they feel like there's some pain in that corner. Okay. Also, it is recurrent because it goes. Sometimes it is quiet, other times it is painful. Okay. Now it happens because the wisdom tooth is the last tooth to come in. Okay. And by that time, a lot of the space has been taken up. Okay. So that is one. Then two, when it is because for it to be the last tooth to come in, it means it's the last tooth to develop in the bone. Okay. So in terms of space and position, it can be very far away. All right. So in terms of your orientation, more times than not, it gets it wrong. Okay. So instead of being upright, it can lean forward, it can lean back. Okay. And so then it will not come into the mouth. And
Where
so
will it be?
why doesn't it come into the mouth?
Yeah.
Because the orientation is wrong, one. And two, there's no space. Okay, so you need space in the jawbone, okay, for it to wiggle itself up and then come into contact with other teeth in the mouth so that it can chew. Okay, and there's no space for that to happen when you are coming in that late. Okay, then there are also genetic factors. So it's possible you inherited, say, maybe a large jaw from your mom. Okay,
That's interesting.
and even bigger teeth from your dad, or vice versa. So you can have a mix match. So you don't pick, if when you're picking jaws, you don't pick your dad's jaw, then you pick your dad's teeth. No, it can cut across. So what happens is that there's a mismatch between space and what needs to fill it. So then it is edged out. It's not able to cut. So those are some of the reasons why the wisdom tooth gives those issues. It is impacted. We refer to it as impacted. It is being prevented from coming up the right way. Unfortunately, if it persists, usually you'll be advised that you need to take it out. Yes, if it persists. But scans will be done because, especially for all of them, but especially for the bottom one.
The ones here?
Yes, the bottom one. We have a nerve bundle, okay, that goes underneath all the teeth, and it starts from around that place. Okay, so that is how come all the teeth get their blood supply, their nerve supply. So it's like a major cable that passes underneath the teeth, and it issues supplies to each of them as it goes along. Okay. So it can be so close that your surgeon wants to be sure what type of relationship it has with that bundle before they go in to try and take it out, so that they reduce the possibility of damage to that nerve bundle. So that's what explains the scans and those that were requested for. Yeah.
Okay. Thank you so much. That's very interesting. Thank you. Thank you. So let's move on to the next question. How do you educate someone, for instance, children or people who are disabled? How do you give them dental health education? Do you have a format already written down that you go through so that they get this information?
So, thank you for the question. It's
You're
a very
welcome.
interesting one. So, especially in my I'm still in my early years of practice, but I found that it seemed to be a very difficult thing trying to explain verbally
Really?
to children, especially what you want from them.
Okay.
So if, say, you have a child and then all you are just bombarding them with big English and non-scientific words that they don't understand, it would be very hard for you to get the response that you want from them.
Okay.
So the best way, especially for children and for disabled people,
Yeah.
is we try to do show, tell, and do. So we try to show them what we are going to do. At least give them a demonstration. I have a model here which I brought. This. So we try to just demonstrate what we are going to do. If it's brushing, if we are going to give, like, say, an injection, we need to take out the teeth. Don't need to be a simple procedure, but we need to give anesthesia. We need to make sure that it's a completely painless procedure so that the child doesn't react, doesn't cry. You can't just tell the child, come to give you an injection, you lie down.
Yes, they will not agree.
You will never get a response.
Yes.
So you have to try to break it down slowly. You try to explain, I want to give you a small mosquito bite.
Okay.
And then you try to, after all this, you also try to motivate. Some children, whether you tell them, even if you do the demonstration and everything, they will still not listen.
Exactly.
So you have to motivate. That's where try to give prizes. I'll give you a pen if you behave. I'll give you a pen. Aside from that, you also have to involve the parents in all of this. Okay, they play a very important role. Sometimes you go to a clinic and then the parents leave the child in your hands. They don't want to be involved. They sit in the corner and then watch you suffer with the child.
So what do you do?
So you have to. So basically, you have to get the parents involved. Okay, so the parents, they know their children more than you do, who has now met them for 5 minutes. So they can help with the motivation. They know how best their children work. Whether their child is a count child, whether it's a bit more on the troublesome side.
Exactly.
So they'll be able to help.
Yeah.
But I also like to say it's not advisable for parents who take their children to the dental clinic or even across, apart from dentistry, to the hospital, to be scolding their children. It makes them a bit more timid and afraid of the environment. It makes treatment a bit more difficult.
All right. I think that's very true, because children don't like to be, bullied here and there or pulled here and there, do this by force, So, here you go.
Okay, so so that with the special needs,
yes,
patients,
I was about to ask.
Yeah.
The special needs, with those who are blind.
Okay.
Are you able to give them such education, since they also need to know about this?
Yeah. So, they all benefit from the education. So they may not be able to see a demonstration, but they can feel a demonstration. So when you have a hygiene visit, so that is when the hygienist will clean the teeth, okay, with our equipment. Okay, they also will teach you how to do cleaning at home. So home plaque removal, how to take care of the teeth, to do plaque control. And they'll use the things that are available to you at home. So your brush, and so they'll show you Okay, so move from one side of the mouth to the other, and that's the person can feel, the person can appreciate and replicate it at home. Okay, so whether it is with flossing, with brushing, or other cleaning aids, okay, so they can follow. Then with our clients with special needs, we fall a lot on the caregiver. Okay, so with them, as with all of us, prevention is very important.
Very.
Okay, so we'll go into the main reasons why we have decay. Okay, so earlier on I mentioned that in our environment it's really strange. It's quite foreign. It's until recently. That is because, for example, if you were to remove simple sugars are sugars or food items you put in your mouth, and immediately you taste sweetness. Okay, so when you put something in your mouth and immediately you taste sweetness, it's a sign that it's a simple sugar. You are tasting the sweetness because it has started breaking down in your mouth. It didn't even travel to your stomach. Okay, it is very simple. Now, bacteria in our mouth love simple sugars because when it breaks down, it means they can also feed on it. Okay, so once you eliminate that, and that will be in the sweets, the sweet beverages, the candies, some pastries, cakes, and all that. Once you eliminate that, you'll be surprised to know that there's no way a hole will develop in the tooth.
Really?
Yes.
It's interesting.
Yes, because so we'll discuss there are certain factors that need to exist before a hole develops in it. Some are modifiable, things you can control. Others will be there irrespective. Okay. So with clients who have special needs, you see that they gain an advantage if in their diet we don't introduce such simple sugars, for example, either to pacify them because we want them to be calm and quiet, and things like that, because then the chances that they are going to develop holes is almost zero. Yeah. So that's with them, that's one. And then also I like to say that ourselves as professionals and even the caregivers, you see, you count the little victories. So with those clients, you may not be able to do as much work as you do, okay, because they may not be able to be in the chair for a long time. You may not be, some parents even tell you they're not able to do good cleaning for them every day or twice a day. Okay, so it's encouragement. I mean, so the time you're able to do it, count that victory, and then you do the other things. You don't introduce them to those simple sugars. You don't use those ones as a go-to to calm them, to pacify them, and things like that. And we'll make a lot of progress. Yeah. So he was going to demonstrate something on the model. Yeah.
It's part of my questions. Can you demonstrate how, the right way to brush our teeth? And also, in brushing the teeth, right, is it good which of them is better, manually or using the electric brushes?
So, before I demonstrate, let me answer the latter. I think that one is just a matter of opinion.
Okay.
If you have problems with angulating a toothbrush, or the amount of you often use too much force, or other factors like that,
Okay.
an electric brush can be very favorable to you, because you will be able to get more, cover more surfaces with an electric brush with an even distribution of force. But that notwithstanding, a manual brush is also very good, as long as you are able to cover everywhere that you need to cover. Okay.
All right.
And people have a problem with how much time they spend brushing.
Yes.
Some people, you see, once you start with an even amount of force, the force starts to reduce over time. Ideally, you are supposed to brush for at least 2 minutes and not more than 3.
Really? Why?
So when you brush for less than, it means there is no adequate plaque removal. Plaque basically is the build-up of, say, it's just a film of all the food and other things which has built up over the teeth over the course of the day, between the last time you brushed and the time that you are now currently brushing. So if you are not able to brush and cover all the surfaces even within that time, you are probably not doing it right.
Wow. And how do you know that you're not doing it right?
So that's where now our friend comes in.
Okay.
Okay. So most people tend, when they think about brushing,
Yes.
and when you see in, say, the movies or other things, you just see a horizontal brushing sequence, something
Yeah.
like this. Okay. Now this is completely contraindicated. You should never ever brush horizontally like this. This is because the action of brushing horizontally, imagine, say you have, this is a tree and this
Okay.
is a saw. If you continue to brush like this, it's like you're cutting a tree.
Yes.
Okay?
Yes.
So if you notice, for people who brush like this for a long time and they couple it with a hard toothbrush or anything, you will notice that they have certain cavities at the neck of their teeth. So it's an action called abrasion, using a hard instrument, which it could be the toothbrush in this sense, to continuously brush and wear off the surface of the tooth. So it's at the neck of the tooth. We call it the cervical abrasion at the neck. Okay. So the appropriate way to brush is to angle the brush at around 45 degrees to the gum. Okay. And you brush in a circular motion away from the gum. Okay. This is because we are trying to sweep down all the bacteria all the food particles and debris from the gum in a circular motion. Okay.
All right.
So that's the way it should be done, not this way. So we will try to angle it and sweep downwards.
Sweep downwards.
And vice versa. My model doesn't have lower teeth, but imagine it was this way.
Okay.
It's the same. So we are just trying to sweep away in order to get as much food debris out as possible. Okay. Apart from that, we are going to couple it with flossing. Most of the time, brushing alone can only cover about 60% of the surfaces that can be covered, but in between the teeth and completely can't be touched by the brush because of the contacts that the teeth make. So flossing is a very important part of oral hygiene, which most people neglect.
Oh, okay.
So it's something that our advice may need to do. We can demonstrate that.
That's very exciting. But for now, thank you so much for the questions. We'll be going for a short commercial break. Stay tuned.
With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians.
Welcome back, viewers. Let me remind you, viewers, that we are live on our social media platforms, both on YouTube and Facebook at the Trinity United Church, East Legon. You can send in your questions and your comments on our social media platforms or WhatsApp us on 050 579 996. Welcome back, gentlemen. We've learned a lot so far, so much so far. To our next question. That's to you, Mr. Clarence. What advice do you have for people who struggle with maintaining their dental hygiene?
Okay. So, thank you, Chan, again for the question.
You're welcome.
So this is a very good question as well. My advice is to try to take it very simple. Okay, so it's a day at a time. So most people try to do everything quickly. Try to, and like many things in life, something that you're not good at, you have to practice small. It takes. They say it takes 21 days to form a habit.
Yes.
Exactly. So you have to start little by little. So don't rush to do everything. You've just started taking your healthcare seriously, and then you, although it would be very good if you could, but suddenly you want to start brushing 2 times a day when you weren't doing that first, and then along with that you also want to couple it with mouthwash, and then you want to couple it with flossing, and then you want to couple it with regular dental visits. All of this is can be too much to remember.
Yeah.
So simple advice is that we set reminders. Simple things like alarms and other things. When it's say 9 p.m., you set an alarm, because most people tend to forget to brush in the night.
Yes.
When it's
Lots
9
of
p.m.,
people.
when it's 9 p.m., you just set an alarm.
Okay.
A daily alarm is 9. It's time to brush again. When my mouthwash is finished, I should just go and get some. Simple reminders like that, just to remind yourself that okay, it will just help you take your healthcare, oral health more seriously. Aside from that, you should be more cautious when you are brushing. You shouldn't try to use too much force, again, like we said during our demonstration, because it can easily affect the strength of our teeth. Okay, it can cause simple wear like that. So when people, especially people who are who say they have a lot of dirt in their mouth, they try to use too much force, and they are doing it without advice. They haven't seen a dentist in a long time. The assumption is the harder you brush, the more dirt they are going to remove, and that's just not feasible. Because some of the dirt is there, it can only be removed by professional cleaning. So then again, you should also seek regular dental checkups. And
how consistent should you do that?
So the practical advice is to see a dentist every 6 months. A lot can change within, even in days. You can see a dentist today, and in 2 days' time, a lot has changed in your mouth. So, but we advise at least every 6 months to a year. More practically, though, especially in this setting, I would advise 6 months, but I think more practically, at least every year, you should at least pass by. Just to, if not for anything, you should have a professional cleaning done, because that's what will lead to more gum disease and other things if the debris is not well taken care of. And if my senior doc will have something to add.
Mm-hmm. Okay, so I will just add that you need to get into a routine. Okay, just get into a routine. So if you do things randomly, you're going to, when you look back, you'll be dissatisfied with what you've done. Your motivation will go down. You're not likely to continue. So get into a routine. So apart from the routine of say morning, evening, whether you're assisting yourself with the alarms like you mentioned, okay, so in the actual practice of the brushing, you must have a pattern. And when you are doing your oral hygiene, you should have a dedicated time. It should be you and the process that is going on, okay? So that you're not distracted. You see, a lot of the time, somebody will pick a brush, put So this is how I pick a brush, you put the paste on, and then you start. You start one side. Then somebody calls your name.
Yeah.
Okay, or the kids, you're distracted, you go and talk a bit, then you come back, what do? You go back to that same place.
And continue.
And then you do that again, something comes up, you go. So there are areas in our mouth so we call them skipped areas. So they are skipped areas. Okay, so anywhere you have cavities are places you don't brush. No matter, you feel that you did brushing, but the cavity is there because it's a safe haven for the bacterial plaque. Okay, but if you build a pattern, okay, so routine, then you have a pattern and you stick to it. Then we talked about the length of time, so that is also part of the pattern. Okay, and you can also make it fun. So a lot of us in the mornings, we have like music that we play.
Yes.
Okay, some gospel music, you get it. So imagine that there's one of these tracks that you associate with your brushing. Okay, so what's the length of a typical track? You get it. So you're looking at what, 2.5, 3. You get it. It's the same thing. But by the time that is done, you have finished brushing and you are doing the same thing all the time. Okay.
Twice a day.
Twice a day. And the evening brushing is difficult because at that time you are tired and you are tempted to even snack afterwards sometimes. Okay. But a colleague at work said something that she heard somewhere, and I feel that it's something that will ginger us up. So you see, you brush in the morning to keep your friends.
To keep your friends.
Yeah. You brush in the morning to keep your friends, right? Because you don't want to leave home with the morning dryness of the mouth and the bad breath you woke up with because of the dryness. But the evening brushing, you do so to keep your teeth. Okay. You brush in the evening to keep your teeth. We harp on the evening brushing because when your body has a rhythm, it has a rhythm, okay? The activity of your body is not the same like in the morning, the afternoon, in the evening. When you are going to bed, saliva flow reduces. In the evening, saliva flow reduces. That's how come you wake up in the morning with a dryness and sticky saliva. Your mouth is not fresh, okay, because saliva reduced. Okay, that means you are not washing away debris. You are swallowing less. Okay, things like that. Okay, bacteria is happy. Okay, the environment is stable. Okay, so that is not the time you want to leave food. Okay, readily digestible food in the mouth available for them to feed on. So the evening brushing is important, and you do so to keep your teeth. Okay, so with those two pillars at the back of your mind, I bet you'll be very motivated.
Keep your friends.
Yeah, morning to keep your friends, evening to keep your teeth. Yeah.
Actually makes sense. Okay, there's this question I want to ask with toothpaste and then the toothbrushes. Nowadays, we have a lot of companies producing so many kinds of toothpaste and with the toothbrushes as well. Which one do we go in for? Which one will do the work? And which one? Which of them is the best? I used to use one Colgate toothbrush and I loved it so much because it was not all that hard, even though it did the work, and it was also small. It could enter my tooth. Yeah, but nowadays we have a lot of hard brushes in town, and we don't even know which one to go in for. So, can you recommend any?
I go along the lines to say I don't represent any brand. So, you shouldn't. The most important thing is for toothbrushes.
Okay.
We recommend medium bristle toothbrushes.
How do you know?
So it's written on the pack. Okay. So usually when you go to a store, people just say I'm going to buy a toothbrush and they just pick whatever is on the shelf. Yeah. So I think we need to be more aware of what we are selecting when it comes to toothbrushes and toothpaste. Okay. So the ideal is a medium bristle toothbrush or soft for some, but it should never be a hard toothbrush without recommendation. Okay, so hard bristle toothbrushes are what typically cause the wear. So it's like I said, it's going to be like a scrap. Like you when you're brushing, then you can literally hear the sound. So so we advise medium bristle toothbrushes because they are very gentle on the gums, and they are at the same time they are firm enough to be able to remove the food debris, the buildup which has occurred during the day. The ones which are not hard and which don't need to be mechanically removed by a dentist, a professional. For the toothpaste, there are a lot of brands on the market, like you mentioned. They tend to serve different purposes. Some are there for anti-sensitivity, and some are just generic brands. Okay. The most important thing, however, is about the fluoride component. Okay, the fluoride component is what helps improve the overall strength of the tooth. Yes. So there are certain brands which don't contain fluoride at all, but tend to spring up on the market. But people just go to the market and say they are buying toothpaste, and then they get those ones. Okay. I don't want to name any of them because it's someone's business. Yes. But it's not advisable. So the most important thing is that they should have fluoride content. But the most common ones that we see on our market are the Colgates, the Pepsodents, Sensodyne. Those ones have. Yes. So those ones have adequate fluoride content and have been approved. In terms of the flavoring, usually some will come, they'll tell you they are herbal, they are charcoal, the other thing is whitening. I wouldn't necessarily say that they play a role in what they are advertising, but the most important thing is about the fluoride. That's what
what is most important?
The most important thing in the toothpaste. It has to be fluoridated.
That takes me to my next question. With regards to mouthwash, is it very important?
Okay, so
and how often?
How often? Okay, so mouthwashes. So to discuss mouthwashes, I'll start off by explaining what our aim is. So when we brush, our aim is to remove bacterial plaque. So bacterial plaque is, like it's mentioned, a soft layer that forms on the teeth. Okay, to form whether you like it or not. There's not much you can do about it. What you can do is to disturb it. Okay. So you disturb it in the morning, you disturb it in the evening. Morning and evening. Now when you brush and you pass your tongue on your tooth, you feel that it's very smooth. Yes. A few minutes after that, it starts becoming rough. Bacterial plaque is forming.
Again?
Yes, because it is a constant cycle. But you are winning because it is new plaque. It is not mature and aggressive plaque. Okay. Just like when you cut down a forest, as it starts sprouting again, it is not as dense and as effective or as dangerous to pass through like when you have it short. So that's what happens when you disturb plaque in the morning and evening. And the only effective way of disturbing plaque is mechanical. Okay. Okay, so by brushing, by flossing. So it's a mechanical action. Okay. Mouthwashes don't exert mechanical force.
Okay, what do they do, please?
They just coat. So they coat. So if you have put a mouthwash and you swish it around, you are coating the surfaces. Okay. And that's so when you read research, you realize that it modifies the surface of the tooth. So it makes it less friendly. Makes it less friendly as a home for the bacteria. But doesn't mean they will not survive. They will not be there. Okay? So you need to brush. Okay? The mouthwash is an adjunct. Okay? So it's an additional thing.
So do you do it before you brush or after you brush?
Well, you brush first. I will say you brush first. Just like when you visit us, we'll clean for you. Yes. And then we'll give you the mouthwash. So, okay.
So at the dentist, that liquid is that a mouthwash?
Which liquid? When you are cleaning?
Yeah. I don't know, but
Okay, so our instruments, all our instruments, okay, because we are cutting or knocking the tooth, they generate heat. So when you visit the dentist, you see that there's a lot of fluid. When we are cutting, whether we are cleaning, there's water.
yes.
That is to cool the instrument and the tooth. So that water is not mouthwash, even though you can incorporate that. So in some systems, when people are doing the hygiene, instead of using plain water, they may also have an active agent in the container, and that comes into the mouth. Yes, but then you mentioned in the cup. So after the cleaning, you'll be asked to rinse. In fact, after all procedures, we asked to rinse, and usually that is a mouthwash.
Oh, okay.
So it's a mouthwash. Either it's water with a mouthwash tablet, okay, and that is dissolving, or mouthwash itself. Okay.
Okay, so we have a question here from Madam Vida Kwapon Ekufu, sorry. And she's asking what the best way is to manage receding gums, especially as we grow older. Yes, please. Would you like to take it?
I'll start if there's anything to add. So, again, another excellent question. So, like he was talking about earlier, when we started, he mentioned something about gum disease. Yeah. And I also said it was something which was more common as you are aging.
Yes.
All right. So, receding gums is just a common sign that you are losing basically support for the teeth. Okay? So the gums are part of the greater body of can I say organs or components which support the teeth. So we have the gums, then we have certain small ligaments which hold the tooth itself inside the bone so that it's firm and strong inside. Now as you continue to age,
yes,
and if the gums are not well taken care of over time, say you don't frequent the dentist, you don't brush as often, there's a buildup of bacteria which can affect the gums. So that's the way the gums and the supporting structures fight this is by receding. They start to go down in terms like they are trying to, as they are battling at the top, they start to recede slowly down. And it can get to a level where it's around the lower aspect of the tooth, the root. And once it gets to that point, you may notice that your teeth have started to shake, or you notice that your gums have started to bleed spontaneously. You haven't even started, maybe you're not brushing, but you are noticing bleeding. Or it's very common, every time you brush, you notice bleeding. Or your gums have become very firm and somewhat swollen. So these are common signs that you need to come to see a dentist. There's a special dentist called a periodontist. They take care of the supporting structures of the teeth. So in that, there are an array of procedures which can be done to help to manage it, to limit it. And if possible, they can also help to, I wouldn't say regenerate, but help to stabilize the teeth if they started to shake. So the best advice I can give is to see a dentist so that they can arrange and start to draw a plan.
Okay. Does it take a long time to take care of it?
I would say most procedures, and the thing about dentistry, most people think you come and then you get instant results. So especially for periodontal diseases, diseases of the supporting structures of the gum, it usually takes a lot more time, a lot more patience. So they tend to be patients for life. So you come, you do say a treatment, you come for a scheduled review, just to monitor to see if there's any change.
Okay.
And so on and so forth. So it's treatment reviews.
So it comes better.
Yes, but this is also very common with the other diseases that we spoke about. So if you are managing, it could be a sign that you could be having maybe diabetes, hypertension. Not saying you do, but at least it could be a trigger that you should go and have a general checkup and rule those ones out first.
Okay.
Okay, so the recession, so other signs, other symptoms for the recession would be sensitivity. Okay, so we described the coverings of the chewing surface of the tooth. So the white, then beneath that the yellow. Okay, and further down is a living tissue that you mentioned becomes inflamed and causes you pain when the cavity, the hole, decay enters. Okay, the root portion, which is 2/3 of the tooth. So the portion of the tooth you see in your mouth is just a third. So the rest of the tooth, 2/3, okay, is in the bone. Okay, that also has a similar arrangement. It has an outer covering, one. It has a middle, then it has where the nerves and blood vessels are. When you have recession, like it's explained, what happens is that you expose the outermost covering of the root, okay, at the neck of the tooth. Unfortunately, that portion is softer because it's supposed to be ideally hidden in the bone. Okay, softer. So then we go back to the brushing Stanley mentioned. So if you brush aggressively, you peel off the outer covering, okay, of the neck of the tooth, the root area, and then your tooth becomes sensitive. Okay. Sometimes even when you have not brushed in that way, because of how the tissues form, there's a gap. Okay, so there's a gap between the white portion and the outermost covering of the root. So there's no overlap. And it exposes the second layer of the root surface, which is sensitive. So when patients complain that they have recession, some of the other signs will be because they're having sensitivity too. Okay, so that can be handled with the desensitizing toothpaste. Sometimes we can apply topical desensitizers in the chair at the surgery. Okay. And then if it is very bad, very, very bad, very extreme times, you may need to take out the nerves, do a root treatment. Okay, so that's the tooth is not sensitive.
Okay.
Sensitive again. So that's about it with recession.
Okay, thank you. Please, we have another question by Ken. And he's saying, with respect to toothpaste, they all have different colors. Code red, blue, black, green. Are they for specific uses? And teeth bleaching or whitening, is it a good practice? If so, how often should it be done? So please.
Okay, so if I can, I'll pick the bleaching. Okay. I first pick. So bleaching, there is cosmetic bleaching and there is therapeutic bleaching. Okay, so you can have situations where someone's tooth is darker, okay, because of disease. And so as part of the treatment, after solving and aligning cause that led to the darkening, we want to lighten the tooth. Okay, so then that is cosmetic. Then what the individual is referring to most likely will be cosmetic bleaching. So in cosmetic bleaching, the tooth is its natural color already. So our natural color of tooth is different for everyone. Okay, it's different for everyone. It is not white. So some are lighter than others, but it can also have the effect where the tone of the skin can also give you an impression that a tooth is whiter than it actually is. You get it? So a lot of things go into the color of the tooth. So then that becomes cosmetic whitening. So the difference is that with whitening, that is done cosmetically. You have to refresh it because the tooth is in equilibrium. Saliva beefs the tooth. There are salts in the saliva. There's always exchange. So salts are leaving the tooth. Salts are leaving saliva into the tooth to keep the structure. Okay? Now, when you interfere with that, through the bleaching, because then you make the outermost portion of the tooth, the first layer, a bit porous. It's not porous to the extent that it will cavitate or becomes a disease. No, it is safe porous. Okay, so when you make it that porous, the way light interacts with the tooth changes. So light does not transmit through the layer to show the inner layer and to give it that yellowish hue. Okay, light is scattered just in that white layer. So when the eye sees it, it is seen as white. Okay, so that is what the bleaching does. The bleaching just creates a little porosities, okay, in the tooth. Saliva is bathed in the tooth. Over time, the salts will quickly realize that our balance has shifted. So they'll put back salts into the tooth, and then the original color will come back. So your dentist will tell you that maybe every 6 months you need to top it up, freshen it, that kind of thing. Okay, so that is for the bleach. Is it safe? Yes, if it's done at the surgery, it is safe. Because the practitioners are trained, the materials that are used have been certified for that, and whatever steps that need to be taken to make you safe will be taken. Okay. If there are contraindications because maybe you have recession, so the necks of the teeth are exposed and things, so dentists will talk to you about it. And so we say, okay, maybe for you, no, let us sort out this first. Okay, because when we make the teeth more porous, there's some sensitivity, but it is transient. It will pass and you'll be fine. So it is safe, but you do refreshes. Okay. Over time. And I think the other question was
the colors of the
toothpaste. Yeah. So whether it's for people, I think it's more to
which of them is good? Is it okay? Okay, no, this is a different question.
So in terms of the colors, you see, they are, like he mentioned before, there are different brands, and every brand wants to be different. Okay, so when I pick a certain toothpaste, I should be able to see it look different. So if you are squeezing paste out of your tube, he is squeezing paste out of your tube, they should be different. So the manufacturer will do something, maybe combine, yours will be red and yellow, his will be, and if his manufacturer is saying mine is charcoal, I'll make sure it is black. You can see the black. So it's just for aesthetics and also to identify the brand. Okay. In terms of the active ingredients, we don't have colors
at all.
No, so the color is an added thing that the manufacturers add to distinguish their products. Yeah.
So please, another question by George Cool. He says, is it okay for us to brush our teeth right after eating? And how does plaque build as a result of stress? Is it okay to brush our teeth right after eating? Let's take that first, please.
Okay. So, advisably, no. It's not okay to brush your teeth right after eating. Okay. The reason is that the mouth is in equilibrium. Okay. There's balance. Okay. So when you immediately eat, it increases the oral cavity becomes a bit more acidic. Acidic, and I put acidic in quotes. Doesn't mean you start feeling any burning or anything, but the mouth just becomes a bit more acidic. Okay, so it gives it more room for the bacteria prefer to be in that environment. Exactly. So once it's in that state, there's a state of demineralization, which by that I mean the components, the white part of the teeth that we see, the bacteria are more active in that phase, so they are breaking down more of that white part. Microscopically, they are breaking down a lot of that part. But normally, after about 30 minutes, say about 30 minutes to an hour, the body naturally remineralizes as the acidic nature of the mouth starts to reduce and becomes more balanced. Okay, so once it becomes a bit more balanced, the teeth begin to remineralize and they come back to normal. So if in that immediate phase that the teeth are demineralizing, they are breaking down, the bacteria is breaking them down, you brush, you are going to clear all the broken down parts, leaving nothing for the tooth to remineralize. So if you continuously do that immediately after you've eaten, and then the breakdown is happening, you clear everything that has been broken down. You are giving more room for cavities to form. So you have to allow at least a small lag period, maybe about 30 minutes, to allow for some remineralization to occur. So that the tooth will build itself back up microscopically, so that right after that, then you can brush and continue.
What about washing with water? Rinsing. Sorry.
No.
After eating. What about that? Is it also okay?
I think rinsing is fair. It's fair, but don't basically, as long as you're not mechanically brushing the content of rinsing is fair, just to try to remove as much physical food debris as possible, to also prevent the sugars, the bacteria from acting on those sugars, the simple sugars that he spoke about.
Okay. So,
would you like to add, or I should continue?
Okay, so it's just a little. So the eating, especially also depending on what you have eaten. If you've eaten acidic stuff, okay, so as part of your meal, you drank juices, okay, and things like that, you soften the tooth, okay. So that is when buffering. So buffering is when you use something that is alkaline. So milk, you see milk neutralizes acidic environments. Okay, so if you have an environment where somebody, instead of drinking fruit juices, is drinking milk, okay, that is excellent, because you are shifting the balance in favor of ions going into the tooth, okay, and that is what the rinsing of your mouth also does. It serves as a clearing, okay, clearing. It dilutes whatever it's in your mouth too. So sometimes we even say after eating, you swish and swallow, okay, you swish water in your mouth, you swallow, okay. And then he asked about stress and plaque.
Yes.
Okay, so when you are stressed in a stressful environment, saliva flow reduces. So if you are constantly stressed, okay, what it means is that your saliva flow rate will reduce, your mouth is drier, and so your ability to clear stuff reduces. So you are going to leave a lot of debris in your mouth, and that will allow for plaque to form and to be more voluminous quickly. Okay, so yes, if that is the mechanism, that is how you form more plaque when you are stressed. Just like some medications reduce your saliva flow, stress also reduces your saliva flow. Yeah.
Thank you. Please, let's move on to the next question by Ken again. Please, on the color code, I'm referring to the colors on the tubes, not with the paste. That's what he's asking.
So yes, I'm aware that there are some. So when you look at the flat end of the tube, there are some colors. So there are some codes. They have meanings. Off the top of my head, I don't remember what they are. But for us, using them at home, our regulatory agencies make it very easy for us. Okay, so you look for the stamp of approval. There are 2 stamps of approval. You look for the Food and Drugs Authority, okay, and they're also looking for, if you are fortunate and the toothpaste has been identified as of a certain quality, say by the Dental Association of the country where you are. They also have their seal on it, and it's good to go. Okay, yeah.
Thank you. We are about ending, and would like to ask of your closing remarks, advices, recommendations, experiences, in just a few seconds.
All right. So again, I just want to thank you for this wonderful opportunity to be able to speak with you, Chan,
Thank you.
and your lovely guests. So basically, I close with the same way I started. The mouth is the gateway to the body. So make sure that you are taking care of your mouth. Regular visits are very important to the dentist. Are very important. You have to visit the dentist very frequent. At least, if you can't make every 6 months, you have to at least make a year. Because a lot is going on that you are not aware of.
Yes.
Most people, when they look into the mirror at night when they are brushing, they don't take a. There are certain things going on that we can't see in our mirrors.
Yes.
That's the dentist has to be able to detect for you.
Yes.
So it's better to prevention is always better than cure. Also, make sure that you are brushing twice daily. At least you floss, because like I said, brushing can only take care of 60% of the surfaces, but in between the contacts of the teeth, the brush can't reach there. So a habit that I want our guests to adapt is to floss, and then yes, basically that. Thank you for the opportunity.
Thank you too. It's your last word.
Okay, so to add on to what is said, I'll go back to the statements that I borrowed.
Yes.
Please let's brush twice a day. Remember that when you brush in the morning, you are brushing to keep your friends.
Yes.
Brushing in the evening helps you to keep your teeth. Okay. And let's stay motivated and know that oral healthcare, just like general healthcare, is a partnership. Okay, so your dental professional staff can do so little. Most of the time, you are by yourself, and what you do impacts so much on your overall oral health. So let's work together as a team. Yeah, that's my closing remark.
Let's work together as a team. This will bring us to the end of Let's Talk About. And I have been joined here by Dr. Osei Tutu and Dr. Clarence Osai. And I have been your host, Akosie Chanyawa. See you same time next week. Good night.